Welcome, welcome, welcome in, everyone. Welcome to Care Concierge with Care Patrol, where education is the heart of everything that we do. We appreciate you being with us today on this rainy holiday. It is difficult for me each year to find green. I have my green on today. Do you? It's an odd color for me. Luckily, my son gave me this shirt. Last year, I think I had to pull a moldy t-shirt out and wear that. And it's interesting to me, don't you think, how we wear a color shirt on this holiday, and yet I don't think there's any other holiday that we wear colored clothing. So we don't wear black at Halloween or red at Christmas or pink on Valentine's. I wonder how this happened to come about. Now, one of the things that we encourage here is your participation. So if you have an idea about why we wear green, join us now or join us later in the presentation at any time by unmuting your mic or by joining us in the chat room. Our presentations are always, or most always, suggested by you, prior attendees. Good afternoon, everyone. Ms. Chestnut, Ms. Siggers, Ms. Underwood, and Ms. Glenn. Thank you for joining us today. Our topic is cognitive decline versus dementia. It was suggested to us by a former attendee. And if you're new to us and you're not familiar with Care Concierge, we're accredited by the Alabama Board of Social Work Examiners and also by the Alabama Board of Nursing to provide and credential these CEUs. And this CEU is, if you are a social worker, considered a live or face-to-face or in classroom CEU versus a recorded CEU or an at-home study. And the reason it is so is because we have an evaluation at the end that's password protected. I'll tell you more about that in a minute. If you're new to us, Care Patrol is an aging care navigation firm. We work with clients to help them understand what's next in their healthcare journey, whether that's a nursing home or home with sitters or maybe into some other setting. But we do all that. We're paid by the providers, so we're free to the clients. We hope you'll be confident in trusting us to help your clients, patients, and friends when they're facing a healthcare crisis or planning for the future. Let's get into our housekeeping. As I mentioned, we're accredited by the boards of social work and nursing. Everyone who completes an evaluation. Happy St. Patty's Day, Ms. Vinson. We were just talking about that. I'm glad you joined the fold. We are accredited and we provide everyone a certificate who does the evaluation. Nurses, we post your hours for you, and that's done within a week or so. Social workers, the board would like you to provide your own. And our certificate comes with a place for you to put your name and license number, and that way it will be, and it says it's a live certificate. So that's a way that you can work with us. Let me give y'all, those of you who are joining us by phone or in the car or not able to see a screen, I'm going to give you now the evaluation link. Again, you must do the evaluation to get credit for this hour. And the link is https://www.surveymonkey.com/all uppercase letters, B as in boy, P as in Paul, F as in Frank, M as in man, B as in boy, X, L as in lady. One more time, I'll read for you all who are making note of it, and I've also posted it just now in the chat room. Here's the evaluation link. Remember, it's password protected. https://www.surveymonkey.com/lowercase r/all uppercase letters, B as in ball, P as in Pam, F as in Floyd, M as in man, B as in boy, X, L is in lady. Thank you for being here, letting some few more people in. Let's talk about our objectives for the day. We are going to define cognition, define cognitive decline, and define MCI. We're going to list risk factors for cognitive decline, and we're going to discuss signs that cognitive decline may be present. So is it normal aging, or is there something else happening? Cognitive decline versus dementia. And by cognitive decline in this description, we mean just simple aging, normal aging. So at what age, I want to get y'all discussing early. Remember, you can join by joining in the chat room or through unmuting your mic. If you're not sure how to do that, move your cursor to the top of your screen. A bar will pop down that says chat and has a picture of a microphone on it, or move to the bottom of your screen and a bar will come up. In any event, you can join in the discussion. So at what age do you all suppose we are at our cognitive peak? What age do you all think we are at our cognitive peak? See, we're going to be slow to join in today. It's rainy, I understand. And thank you for being here. Late 20s, early 30s, 45, 30, middle age, 50 to 55, 25 to 30. Thank you all for 30. Great guesses. I would not have guessed. Well, I might have guessed. Mid-20s, Ms. Johnson says. That's a good guess. Many older adults, as you know, worry about their memory. I'm older. I'm 55, and I worry about my memories. Ms. Walker says 75. You must be 75, Ms. Walker, I'm guessing. And Ms. Fisher, I bet you're 46. That's funny. So we're all concerned about maybe that it takes us a little longer to do something, like it may be balance our checkbook, for example, or maybe forget to pay a bill. You know, that's happened to me. And these are really simple signs of forgetfulness. It's normal. It's not a memory issue by any stretch. Changes are normal. It's part of aging. You know that if you've got any years under your belt. But generally, it's assumed that we peak cognitively at around age 30. And if you think about it, if you look at maybe great works of literature or art or terrific scientific discoveries, these are generally done by people in their 20s to maybe early 30s. And that does not mean that we don't continue to have value and have other ways in which we grow. It just means that cognitively, just like really physically, physiologically, we're at our peak at 30. And of course, that is the average. It varies among folks, but on average, we all subtly, and sometimes not so subtly, decline in our cognitive function. Excuse me, I'm letting some folks in. Welcome to Care Concierge with CarePatrol. Thank you for joining us today. We're talking about cognition at the moment. And so the most common age-related declines you can guess is slowing down in our thinking and sort of difficulty with attention and even maybe multitasking or word finding. This certainly happens to me, and it seems like it happens with increasing alarm that I am at a loss for words. So research indicates that as we age, our brain ages and the structure of our brain changes. We have a decrease in the hippocampal, frontal, and temporal lobe volumes. Our vocabulary, interestingly, and our reading and verbal reasoning remain unchanged as we age, and in many cases improve. This, to me, I think, is the wisdom of the aging. It is the increase in the vocabulary and word ability, thinking and reasoning ability. So what's the difference then, do you suppose, between normal age-related forgetfulness and the possibility that you may be developing some cognitive issue? It's normal to forget, we've said this, and the difference in forgetting things like your keys and dementia is that if you are having dementia, you may not know what the keys are for. Or you may do what I did last week. I went to my P.O. box and I have, all of my keys on my key ring. So I've got my keys in my hand. I go up to my post office box. I take my keys and I push the fob, and I keep thinking the door's going to open, but it doesn't. So I'm pushing my car key fob, trying to open the door to my P.O. box. And I would say it can be a sign of other things, but that certainly could be a sign of dementia. Other signs might include that you or others notice you asking the same questions over and again, maybe getting lost in a place like a neighborhood that was once familiar, having trouble following recipes or following directions. I see this in my mother, who I would say has mild dementia. She no longer cooks, and I think it's because she can't. I don't think she understands the steps necessary to cook, nor do I think she can read it in, a box and heat it up from there. I may be wrong about that assumption, but nonetheless, that would be a sign, and is a sign in her case, of having dementia, becoming more confused about time, when and where what day it is. Now, I will say that as we retire, we may also lose track of days, and you all may remember during COVID, it was easy to lose track of days. So if you're not stimulated during the day, it's quite easy to lose track of the day. So this could be or could not be a sign of dementia. But then we know that if we visit someone who is unclean, unbathed, uncombed, unshaven, who has wrappers and plates around the house, moldy food in the refrigerator, this is a telling sign. We know then that we've crossed the threshold between mom merely forgetting some things sometimes into mom really beginning to suffer some cognitive dysfunction. There's a Sarah Garcia who I came across, who's a professor in Florida. And it's her belief that the feeling of your brain short circuiting is often more likely due to psychological processes. So clinically, we have to ask when someone presents, are these symptoms due to early dementia or perhaps some depressive or anxiety disorder? And Ms. Garcia Beaumier continues to say this trend has only increased during the pandemic, as we were saying earlier. Cognitive decline is neurodegenerative. There is a worsening in your performance in one or more of these areas: memory, attention, or language. Some people begin showing some cognitive aging. Well, most people show aging cognitively beginning in our 30s. Some decline more rapidly, some later, some at an earlier age. When symptoms appear much more than they did, when the forgetfulness is an everyday thing and it prompts a phone call to you, the adult child, of where are my keys, then we know we've crossed the threshold. That is one of the red flags. So normal aging, now let's say this, normal aging will slow down our retrieval of our memory, but it usually comes back in 10 to 15 minutes or an hour. If you're having a cognitive disorder, the memory may not come back. In fact, the memory that you forgot something will not come back in all likelihood. So minor glitches then in memory aren't dementia or cognitive impairment. So this is according to Dr. Thomas Hammond at the Marcus Neuroscience Institute. And he was simply saying that, again, there's a delineation between what is normal, what may be the result of some other disorder, and what is indeed cognitive decline. And many people who might meet that criteria then would stabilize or improve because, again, it's sort of an unanswered origin story. So here are some things you can do if you're in the throes of wondering, well, I'm starting to wonder about my ability to recall, or my ability to find a word, or to put together a child's plaything. And so we would say these are basic tips. I think these would be good tips for just living a healthy life. But if you learn new skills, so many people who are retiring go on to either have a second career and learn new skills, or maybe take up a hobby or multiple hobbies. And these are all great for keeping the plasticity in our brain. And another way that we might both help with our memory and also help in the event that we do have a cognitive issue would be to set and follow a daily routine. People with dementia require routine. Plan your day, make tasks, find a journal, get a calendar, use whatever notes you might have. And this is the point we're at with my mother, is I'm instructing her to uh, write notes down. Problem is, she's not remembering to remember to write notes down, but we're getting better. And now we have pads around the house. And at least I think she can have some comfort, because, when you're losing your cognition or worry that you are, as she now does, I mean, that can be a horrible, horrible, painful, isolating, lonely thing. And so having these notes around, I think, gives her some reassurance. In terms of having that same routine, put things back where they came from in the same place and make that place consistent. This is sort of like telling my daughter when she takes something to put it back. I say these things, but she doesn't put it back. But if she did, I think, would have a healthier life. Staying involved is maybe the most key thing to not developing dementia. And we can do that by volunteering or spending time with family or friends. We know too that sleep is important. Now, how many times have we sat with you, luckily, and talked about different disease states and disabilities? And in each of these cases, we've said consistently that you must sleep well, and at age 55 and up, I believe the numbers of sleep are 7 to 8. And then when you get, I think, over maybe 75, it's 7. And if you're a little younger, it may be 8 to 10, 8 or 9. Nonetheless, get the sleep that you need, exercise, eat well. And one of the other real keys to not developing dementia is, if you have high blood pressure, make every effort you can to control it. And again, that goes back to sleeping well, eating well, exercise, and not drinking a lot of alcohol. Now, it is St. Patty's Day, and so there is green beer for everyone, but just have one. And then lastly, really the things that lead most often, or one of the things, is depression leads to cognitive decline in many, many people. So if you're feeling depressed, don't think you can white knuckle it out of it. Get help. So we've talked about different sort of mild changes in cognition that are considered to be normal in terms of how we age. Dementia is not normal. So normal age-related declines are subtle. As we said, it may be starting to take a little longer to process information than perhaps was in the past. And so it also, when we age normally and we cognitively age normally, we're going to see some effect on our thinking speed and on our ability to pay attention. I see this in myself. I cannot sit down and watch a television show. I just, it doesn't hold my interest, or I fall asleep. And so in abnormal aging, though, decline in cognition would be more severe than me pointing my fob at a post office box or falling asleep during the Gilmore Girls. It would be things such as rapidly forgetting what we are discussing, or difficulties in navigating either the world or the train of thought that we're in or that we're engaged in with others. It would be an inability or a marked inability to solve common problems. It would be the loss of an ability to express oneself correctly in conversation or behaving outside of social rules. And this would be, and we've probably all heard the story of someone taking their parent with dementia into a restaurant and the parent causing a scene and saying, look how fat the waiter is. That's outside of social rules. And when we see that, we better really be alarmed. Something is amiss. And also, abnormal aging will affect the motor system. So when we have cognitive decline, we will also see decline in our ability to move about the world safely. We may become people who trip more often. We may develop some sort of tremor if we have a Lewy body dementia, for example. So it's often difficult then to determine exactly when a person should be concerned about the cognitive changes they're having. And it makes it even more complicated in knowing that the symptoms will vary from person to person. So whereas there may be a symptom that I exhibit that would be an indicator for me, that same might not be an indicator for you. And so it very much then we rely on you, the clinician, you who see the patient day in and year out, year after year. You can be the observers of whether this is significant, this decline in word finding, or if it's just because they're 78 years old. 1 in 9 adults will experience cognitive decline as they age. And 10% of adults age 45 to 65 experience what the Center for Disease Control says is someone needs to stop talking. Who is it? Excuse me, y'all. I'm trying to find who's on the phone with us. Mute all is what we will do. So if you need to speak now, please just raise your hand in the chat room and I'll ask you to unmute. So subjective cognitive decline. So this is happening now to people 45 to 65. And now that I've muted you all, I think I'll unmute you and ask you this question. What then might be some risk factors for cognitive decline? What, as a clinician, seeing people in your practice, what would you think might be some risk factors for cognitive decline? I'm going to unmute everyone, which I have. You're welcome to unmute yourselves now and then participate. And remember that this is a better discussion when you add your voice to it. I just feel like we all profit and are enriched by hearing your experiences collectively versus just hearing mine. Ms. Siggers, thank you. She says being over-medicated, medication, substance abuse. Very good. April Fordyce says cardiac issues, family history, significant psychological stressors. Thank you all for joining in the chat, and anyone else, you're welcome to join at any time. Remember that, and you're welcome to interrupt me at any time. And if you want to interrupt me and ask a question, you can also do it in the chat. I'll read it. Ms. Johnson, thank you. She says trauma, and that's a good idea. But and they're all of those and some more. So the risk factors, first of all, are genetic. And those are the ones about which we can do nothing. But we can change our environmental and lifestyle factors. Again, high blood pressure and depression are the leading causes of the development of cognitive decline. Brain injuries, however, we see that cognitive decline can be, in some cases, certainly in terms of dementia, reversed in those brain injuries. Medicines, I can't remember who said, or improper use of medicines. Think of that, the opioid crisis, lack of physical activity, poor diet. Again, we're going to hammer you with eat right, exercise, and sleep for so many reasons. Smoking, and I mean, that we all know. I think they began the anti-smoking campaign when I was in elementary school in about 1973. And I used to cry at night because my mother smoked. And so smoking, I think, has now been beaten into all of us for 50 years. We know not to smoke, and yet some of us still do. And we also, some of us still drink too much alcohol. And then a lot of us, and a lot more of us since COVID, have social isolation, and we're lonely. And that can lead to cognitive decline and dementia. And there are many health conditions. 50% of Alzheimer's disease are related to high blood pressure and heart disease, which can lead to stroke. Diabetes is a major cause, not a major, but a significant cause of dementia, in that the disease damages the blood vessels, including those in the brain, and it increases the risk for stroke and heart attack, and thus Alzheimer's. In the end, there are Alzheimer's and other related dementias that are genetically inherited, that cause a buildup of proteins and other changes in the brain. There are strokes. These almost always lead to vascular dementia. These are damage to blood vessels in the brain. And depression, again, can lead to attention problems that will link to dementia. Delirium, we've probably seen this. If you've been in an ER, you've seen delirium. Anyone who's of any age, or advanced age, with a UTI will present as delirious. What's interesting to me is that sometimes the delirium doesn't fully clear, where before there was none present. That's interesting to me. We've said drugs and combinations of drugs can cause confusion, memory loss, hallucinations, and delusions on their own. Okay, on their own. And then if you add them to an environment cognitively, which is already ripe for disease, you can really cause some undue harm to yourself. And then there's also, we need to be working with maybe a geropharmacist like Phyllis Brower, who spoke with us earlier this year, into understanding what medicines we may have, or foods that we may eat, or supplements that we may take will interfere with our medications or cause them to act in a way that interferes with our health. Some of these drugs we know, they're fairly also well known. Antihistamines, again, reduce the blood vessel. Medicines for anxiety and depression, sleep aids, antipsychotics, muscle relaxants, excuse me. Some drugs that treat urinary incontinence, and then medications that relieve cramping. And so these medicines, we see a direct correlation between these and dementia, and the worsening of dementia if it's already present. So let's move now into our definition of MCI, which is mild cognitive impairment. And what do you suppose distinguishes mild cognitive impairment from dementia or Alzheimer's or Lewy body? What distinguishes mild cognitive impairment from dementia? And again, we welcome and look for your comments. Thank you for those of you that are joining us and commenting, and thank really to all of you. You don't have to talk to be appreciated. Dementia, we know to be a loss in cognitive functioning. We know that it affects our thinking ability, our remembering ability, our reasoning ability, and our behavioral abilities, to the extent that it interferes with our activities of daily living and life itself. The symptoms we've discussed might be problems with language, visual perception, hence the tripping, or paying attention. And then many people, particularly those with frontal lobe dementia, will have personality changes. Mild cognitive impairment, on the other hand, people have more memory or thinking problems than someone else their age on average, but it doesn't interfere with their daily lives or their performance of ADLs. People who have mild cognitive impairment will be more likely to develop Alzheimer's or another dementia than those who do not have mild cognitive impairment, but not everyone who has mild cognitive impairment will develop Alzheimer's or dementia. So what is dementia? A minority of Americans are officially diagnosed. But according to a study in the October 22 issue of the JMA, Journal of American Medicine, Neurology, 1 in 10 American seniors are currently living with dementia. 1 in 10. Another 22% have mild cognitive impairment. So that's 30% of people over 65. And about 1/3, okay, 30%. A recent study that I found interesting, excuse me, was done by Ohio State and the University of Michigan. Now, that's an odd pairing, isn't it? It was published in February 8th of this year, not long ago. And it studied a broad swath of participants, about 3,500, over a period, I believe, from 1962 to 2022. And of those, about 38% showed some cognitive function, inability or variation by age 54. So that would lead you to believe that the numbers of 1/3 of seniors with either mild cognitive impairment or dementia might really be low, or it may be coming in greater number and with this next generation. So in that study, they found that while it has been reported, and I've sort of said today, that your early life conditions, I know someone, Ms. Johnson, said trauma. But really what we've seen is if it's early childhood trauma, for example, that these really don't account for a high percentage of the number of people who will go on to develop dementia, only about 5, really about 6%. The greater risk, this is interesting, the greater risk to developing dementia is not your early life, and it's not even these other adult diseases that we've talked about, like high blood pressure and diabetes and depression. What it is, 38% of the people who developed some cognitive dysfunction, the risk was that there was some combination within their socioeconomic status such that the education level of both the individual and their parents was at a lower level than those who did not develop dementia. So was their income, wealth, occupations, in other words, their race and their mental health. It's the disenfranchised who develop dementia. The disenfranchised, the poor, the working poor. This is a greater determinant we've found. And whatever your social thinking, we have to find something then to combat this. We can combat this. Can't combat genetics. So this study essentially then says that we need to turn our attention then to the social determinants of dementia, as well as those medical determinants that we've identified. And if you, in your practice, were trying to identify in someone whether this dementia might be related to their socioeconomic status or race or mental health, you would want to try and examine through conversation how secure that person feels in themselves and in their home. Try and ascertain whether they're experiencing some sort of depression. Again, that may be a false marker for dementia. Their level of financial freedom and how much they've been able to build up their brain bank. We'll talk about the brain bank in a little bit. So mild cognitive impairment is not considered dementia. Now, about 10 to 15% of those people who have mild cognitive impairment will go on this year to actually develop a diagnosis or diagnosable dementia like Alzheimer's disease. As you know, Alzheimer's is about 80% of the dementias, but there are another 81 types of dementia that may be at work instead of Alzheimer's. So we sort of then have come to think of, and this probably was already intuitively true to you, that mild cognitive impairment is sort of a transitional stage, really. So it's expected, and it is the expected cognitive decline of getting older. Okay, this is normal aging versus the more serious cognitive decline of dementia. So basically, it really, the difference in how one would identify whether this is mild cognitive impairment or dementia is just in the severity of the symptoms that are presenting. So the severity of the symptoms is how we determine whether we're experiencing someone who has mild cognitive impairment versus someone that has a dementia. It's a broad term, as is dementia, but it basically, when we say mild cognitive impairment, although we say it's normal aging, we also say that it's a greater decline in cognition than the peer group. And the peer group would be both age, education, pending the previous study, and development. It does not mean if someone has mild cognitive impairment that they cannot continue to carry out activities of daily living and live their lives effectively, safely. So again, the terms only talk about the severity of the problem, not the cause. But the most common causes of MCI and dementia are Alzheimer's disease, so MCI is a prelude, vascular disease, so vascular disease may lead to MCI, frontotemporal degeneration, which can be any number of things, and Lewy body disease. The symptoms of mild cognitive impairment that you would want to watch for in a patient or family member or friend will be very similar to those of dementia: getting lost in a familiar place, losing things often, repetitive questioning, forgetfulness of recent events, odd or inappropriate behavior, personality change, decline in planning, changes in diet and eating, changes in hygiene, increased apathy, changes in language. So again, the difference is the severity of these changes. The progression of cognitive impairment and deficits accelerates in the years just before the diagnosis of Alzheimer's. And we see this. So again, we say that mild cognitive impairment, all these things can lead to dementia, but they do not signal in and of themselves they are dementia. It depends on the severity. But the independent living capacity of someone with MCI is not impaired or compromised, unlike someone who has dementia. So the Alzheimer's Association estimates that 15 to 20% of people over age 65 have MCI. Now that's a little higher than the other stat that I posted. But what I'm showing you is that no one really knows. There are no official diagnostic tests for mild cognitive impairment. Your primary care provider would certainly want to review a thorough medical history and do certain labs to see if there might be underlying conditions, again, like diabetes or depression. Interviews and mental function tests, as well as brain imaging. All of these tools can be used, but they're not official. And even biomarker tests might suggest that you have a predisposition to Alzheimer's. But the way that you want to ask about this, the things you want to ask of your client or patient or friend or family member are things about how are they doing taking their medications? Can they tell you the process of how they do it and what they take and why they take it? Are they still cooking and preparing meals? Now, for older adults, this may mean microwave meals, but they're still doing something. It's active. They're not eating crackers and cheese, performing housekeeping chores. Now, they may not be pristine. Your mother's floor may not be as spotless as it once was, but if she's still there, maybe just has a little, mild cognitive impairment, she's still going to be a clean lady. Maybe just she doesn't do as well as often. I've seen with my mother that shopping is starting to become difficult. Not grocery shopping, she does that just fine. But shopping for clothes, she just struggles. I've taken her before and she didn't know. I said, here, try this on. And she didn't know what to do. I had to talk her through going into the dressing room and then shutting the curtain, which she didn't do at first. But this was a bad day for her. But still, if you're seeing something like that, you've got dementia. My mother has dementia. Using the phone or the remote, I would bet that half, if not more, of all calls in any senior community in the nation would relate to the remote. And if not to the remote, to the phone and the operation of it. That's a clear sign of mild cognitive impairment that may also be a sign of a burgeoning dementia. Managing money, most people end up taking over mom's money well before they even admit that she has a dementia or mild cognitive impairment. And then if someone was once a great sewer or knitter or woodworker and now is not, that could be a sign, certainly, of a burgeoning cognitive dysfunction. So here's a great chart I found. It's on Pinterest if you want to see it. And it says, is it mild cognitive impairment? Or is it something else? And so occasionally forgetting a date, word, appointment, or task, this is mild cognitive impairment. It's also dementia, and it's also healthy aging. So all of us occasionally forget a date, word, appointment, or task, and that's part of aging. It's part of being human. Slight difficulty paying attention or multitasking, well, we've said that's mild cognitive impairment. It's also Alzheimer's disease or other types of dementia, and it's also healthy aging. Now, forgetting something important that you usually would remember easily, like, I don't know, something to do with your dad's estate or the name of your nephew. This is a sign of mild cognitive impairment. It's also a sign of dementia. It's not a sign of normal aging. So forgetting things that you would have easily recalled is not a sign of normal aging. Having trouble coming up with words, more so than your peer group, would be a mild cognitive impairment, perhaps, or not perhaps, for sure, and also dementia, but not necessarily, again, not healthy aging. Struggling with complex planning or tasks, definitely dementia, definitely mild cognitive impairment, again, not healthy aging. Difficulty with basic activities like toileting or dressing, that's dementia. That is not mild cognitive impairment. Problems with language in such a way that you have a difficulty carrying on conversation. Persons with mild cognitive impairment can carry on conversation. Odd or inappropriate behaviors, that's dementia. Personality changes, dementia. Problems with balance, dementia. None of these things are present in mild cognitive impairment. repeating a question or story multiple times, dementia. Excessive tripping, falls, tremors, dementia. Wandering and getting lost, dementia. Now, we said that getting lost may be a sign of some mild cognitive impairment, and it may be, but being lost, like truly lost, that's dementia. What might be some signs of mild cognitive impairment or decline in thinking and a departure from healthy brain aging? What might be some signs of mild cognitive impairment or decline? What might be some signs of decline, cognitive? Well, trouble staying on top of things is one. If you begin to have this issue, then you may need to see your physician or provider. So the corticolimbic system in our brain modulates our experience of anxiety. Ms. Vinson, difficulties with remembering standing appointments. Very good. Thank you for commenting. It also happened, this is again, Ms. Garcia Beaumier, maybe she may be Dr. Garcia Beaumier. It also happens to be the same area of the brain that helps with processing speed, attention, planning, judgment, organization, and lots of thinking skills. So if there's a change in this area of the brain due to stress or anxiety, these cognitive skills are also affected. There is an overlap in the brain pathways, and the larger amount of our resources in terms of our brain health go towards modulating stress, or the more that this happens, rather, that the more of our resources we have to apply to modulating stress and anxiety will lead to not enough energy to combat the onslaught of cognitive deficit. Those same pathways that overlap also process information. And if you are seeing some injury or decline in those areas and you can no longer pay attention because of that, well, then you're not going to form and record memories. If you can't pay attention, you're not going to remember what was happening. And then, some of these lapses may be related to psychological distress. And this is why we bring it up. We want you to make sure we rule that out. But even if not, if someone is simply experiencing high stress and they don't do something about it, they're putting themselves at a higher risk of developing mild cognitive impairment or dementia later. Other signs would be you can't find words. So this is kind of a sensitive indicator of early decline. So there are, many times, as I said earlier today, I have, difficulty finding words. I'm sure many of us do. But if over time we start having more difficulty in terms of a daily kind of occurrence, multiple times daily, that leads to us having confusion and anxiety because we're afraid we won't be right, or so to speak, then that's a sign that there's some mild cognitive impairment. It's not fully known why, but the research into the brain shows that the language decline often originates in the left side of the brain. And we also know that those who are experiencing this have a lower production of the neurotransmitters called BDNF, which basically help us to create new brain cells. And if there are fewer of those, we're going to have continued cognitive issues. So as we age, that protein declines like many other parts of our body. And so we rely on it as a sort of fertilizer to build and grow our brain. And if we start lacking it or lacking it in great supply, then we know that we're going to experience cognitive decline. So here's some tips. We're all losing BDNF. If you want to boost that in your body, try eating blueberries, turmeric, which is good in certain dishes I use it to cook with, green tea, and dark chocolate. And I've got some comments now I want to take a break and go back to. Forgetfulness, Miss Alexander said about a sign, problems remembering driving directions, Ms. Frazier, thank you. Ms. Inda, my mom has been diagnosed with advanced dementia. She is still able to participate to activities in her independent living. She does present herself with several of the symptoms listed. Mom speaks French and English, and she has started getting confused who to speak to in which language. How interesting. Ironic that speaking several languages helps fight dementia. Isn't that true? Your mom sounds like a real force. I'm so sorry that she's seeing this decline. I know that's difficult to watch, but it's fascinating to think of the processing of the language and to whom to speak to. Thank you for sharing that. Ms. Indra. If you feel sort of blah about what you used to like, apathy can be normal, or it can be a sign of severe cognitive decline. And this is the symptom that we find is most often overlooked. So the telling sign that one may be having mild cognitive impairment or entering that period would be that they lose their ability or lose their interest in old hobbies or things they enjoy. It's in half of all cases of dementia. This is reported as one of the reasons that the diagnosis was given. And it also leads to believe that someone will find that what used to be easy for them is now impossible. This is unfortunate because withdrawing from the situation is known to speed up the decline process, she says. And here's the thing, when apathy creeps in, the best step to take is to incorporate it into your daily life activities. So that will boost your participation in your hobby and thus boost your participation in life and loosen up and keep plastic your brain. You've been acting out of character. Now, this is certainly a sign of dementia, but it can be a sign of mild cognitive impairment. It's subtle, often missed, just like we often miss that someone has lost interest in old hobbies. We sometimes don't make note quite yet that the personality has changed or is changing. And the problem is that stress can provide the same subtle personality changes as would mild cognitive impairment. Withdrawing from things socially, if mom stops going to church, or if you can't get dad to fish, or go out to breakfast with his friends at the McDonald's, then that's a sure sign. You might notice that if your loved one was once the life of the party and kept everyone laughing and now sort of is quiet, that's a sign. And regardless of any treatment that we hope to prevent or reduce cognitive decline needs to incorporate stress management. We've done some things on stress here. This is according to Dr. Torgerman, Isaac Torgerman, who is in Florida, professor. Always ruminating. This also, I think we talked about, is part of chronic grief. Complicated grief is ruminating. Also depression. So again, we may not know if someone presents if there's something else going on, complicated grief, depression, some other issue. But if we're stuck in that place of ruminating and worrying, filled with anxiety, we're stuck in this fight or flight sort of place. And this uncontrolled toxic thinking has the potential to create a state of low-grade inflammation across the brain and body over time, which can impact our cognitive health and ability to remember or recall information. This is a Dr. Carolyn Leaf. She's a neuroscientist, and I recommend her book, Cleaning Up Your Mental Mess. If left unmanaged, this kind of chronic cognitive upset will progress or can progress into varying levels of cognitive decline. The resolution is to find the underlying cause, of the rumination and address it. If you've recently been sick or have a chronic condition, there's something called cognitive dulling. This is a feature that's associated with someone who's chronically ill or and generally medically in medical clinical circumstances. The flu can lead to cognitive dulling. UTIs, we discussed before, can gastroenteritis. Metabolic stress caused by a minor infection will often lead to metabolic encephalopathy, which is simply a transient cognitive decline. So other conditions that can lead, similar to psychological distress, sometimes symptoms can be resolved if it's due to these conditions, but if left untreated, it does increase the risk of dementia down the line. Now, depression can result itself into something called pseudo-dementia, where it sort of masquerades as cognitive impairment with forgetfulness, attention, and lowered energy and motivation. Other people notice your mental glitches or signs, you need to go. Now, if other people are bringing to you something, then that's a sure sign. There is no reason to question that. So can mild cognitive impairment be reversed? Move quickly, we're running out of time. Let me repost into the chat room the link so those of you who are here can see it. Some activities protect the brain by establishing a cognitive reserve. This is the brain bank we mentioned, and it helps our brain be more adaptable and more able to compensate with any dulling of the brain through a cognitive dysfunction. There's a trial that was done, the Advanced Cognitive Training for Independent and Vital Elderly Active trial. You can look at it. It was healthy 65-year-old adults that participated in 10 sessions of memory training, reasoning training, and process speed training. Now, each of these adults showed improvement at the conclusion of this training, but the evidence shows that these improvements lasted for 2 years. So is there the ability to reverse? There's no current medications that we know of, and it usually doesn't affect someone's task ability. I'm trying to go quickly, y'all. So if you get a diagnosis of MCI, make sure you see your physician every 12 months. I was going to say, I had a client whose wife has dementia. We moved her from one place of his choosing to what we think is a better place that I helped him find. But he called me some weeks later and said, there's this place in California and they promise to reverse dementia. And it's $15,000 a month. And I thought, oh, Lord. And the man had the money. But to me, I'm dubious. I'm dubious. The password, Ms. Cassimus, is, and I'm typing it in, blueberries, as in eat those for brain health. Password today is blueberries. Protect yourself from unproven claims. Thank you for staying with me. I'm sorry to have run out of time at the end. The address for the survey is, again, https://www.surveymonkey.com/r/all uppercase letters, B as in ball, P as in Pam, F as in Frank, M as in man, B as in boy, X, L as in lady. The password is a capital B, blueberries, plural. Capital B, blueberries, plural. I'll be getting out an email in the morning to you all with your certificate. You must complete the evaluation to get a certificate, and the evaluation turns off at 8 a.m. in the morning. So if you can't get to it today at work, I understand it's a Friday, it's difficult. Try and get to it before 8 a.m. in the morning. Code word blueberries in the plural, and the address I've read for you. Thank you all. Thank you, Ms. Johnson. Thank you, Ms. Vinson. I appreciate y'all being with us today. Please join us on Monday. On Monday, we're going to have Christy Baines with us, who has received a TIPA Snow training. If you know TIPA Snow, which is the positive approach to dementia, and I think we're going to learn a lot. I'm really looking forward to it. I hope you'll join us Monday. I appreciate you joining us today. Thank you, Ms. Goodson. Thank you, Ms. Kimbrell. I appreciate y'all being with us. I appreciate y'all, everything that you do every day for everyone. And I hope y'all have a great rest of your day and a great weekend. So thank you again for being with us. We certainly owe what we do to you, and we appreciate